Hi, welcome to Radiography News Ghana. I'm Gilbert. I'll be taking you through lumbar X-ray. It's a practice that you have been doing for a long time, but I want to just review a new side of it to you. I hope you benefit from it and to change your practice too. Thank you. Stick and stay. Patients come to a department with X-ray request form, which the indications are spondylolisthesis, lower back pain, neoplastic processes, osteoporosis, spondylolisthesis, spondylosis, and the rest. And when we do it, it requires that we do a lumbar X-ray for them. And what we do is AP and lateral. But today we'll be focusing on the lateral projection. So when you look at the anatomy of the lumbar vertebra, we have the body, the pedicle, the lamina, the spinous process, transverse process. You have the superior and the inferior articular processes. So when the patient comes to a department and we do it, the patient will lie in the lateral recumbent with the knee flex, and the patient's hair will be on a pillow with mid coronal plane aligned with the CR and the R on the table, and we expose on suspended respiration. But you have to know that while the patient is lying that way, there's a sagging of the vertebral column towards the R. This is because of the lateral flexion, or the spine may be straight, but it will tilt at an angle with the IR. This will often occur when you are dealing with a patient who has inverted triangle, that is patient with broad shoulders, narrow hips, or also have patients with wide hips, narrow shoulders. We have apple patient, we have rectangle patient, lean column patient, the neat glass hourglass patient, the full hourglass patient, and the rest. All these affect the position of the patient and the alignment of the vertebral column when the patient lies. So when the patient lies this way, you could see that the divergent X-ray beam will not align parallel with the intervertebral disc spaces and perpendicular to the vertebral bodies. And the resulting image will demonstrate close intervertebral disc spaces and distorted vertebral body. This one, the disc spaces are not close and the vertebral body looks distorted. You might see it as you have done a very perfect lumbar and you might pass it, but a doctor might take it and make it look as if the patient is having a very close intervertebral disc space, which is in the case a problem to the doctor. And this is how you'll be seeing it. Instead of the edges of the vertebral bodies to be superimposing so that you can see it as sharp as this, you'll be seeing it as very close like this. So the best practice you have to do is that the patient has to lie the lateral recumbent as how you used to do it. I just place something between the knee and the ankle, and you have to also place a radiolucent sponge from between the lateral body surface, the table, just superior to the iliac crest, elevating the sagging area. So this is what we are talking about. So, and the sponge should be thick enough to bring the vertebral column close to the or parallel with the table and the R. So, and for a patient whose lumbar column is tilted with open joint spaces or distorted vertebra can also be obtained by angulating the IR perpendicular to the lumbar vertebral column. So if the foam or the sponge radiolucent thing is not too thick enough to bring it, you have to also adapt this process, and it will help you open the joint space. You might get it correctly. So as you can see, these images, they are all positioned very well, and you are seeing the joint space open and the vertebral body edges are superimposing on each other. This is a very funny thing that a radiographer adapted to correct all the mistakes he has been making. So he had a piece of string attached at the level of the focal spot of the X-ray tube and a pencil at the level of the patient's spine, and move the pencil through an arc to ensure that every spinous process was aligned with the arc of the circle centered at the focal spot. It's very funny. It's very interesting, and I think the person used it to benefit more self, and person got a very nice images. So please, if you find this very interesting and very useful, and you practice it, kindly come back, comment, and you can also reach out to me at stgilbert at IG, or you can email me at gilbert04@gmail.com. Thank you very much. Have a nice day.